Hi everyone, welcome back to my YouTube channel, and today we are going to talk about dental pulp histology. So let's start our topic with introduction. Dental pulp is a soft connective tissue located in the central part of the tooth, enclosed by dentine and in the crown by enamel. It plays a vital role in dentine formation, perception, nutrition, defense, and repair. Histology of dental pulp helps understand its cellular and structural organization, which is essential for clinical dentistry, especially endodontics and pulp therapy. Definition: dental pulp is defined as highly specialized connective tissue that occupies the pulp chamber and root canals of teeth, consisting of cells, extracellular matrix, blood vessels, lymphatics, and nerve fibers. It is responsible for formation of dentine, that is also called as odontogenesis. It is responsible for sensation, nutrition, and immune defense. Structure of dental pulp. Dental pulp can be divided into four zones from the periphery near dentine to the center. They include odontoblast layer, that is peripheral zone, cell-free zone, that is also called as zone of Weil, cell-rich zone, and pulp zone. First layer is odontoblastic layer, that is also called as peripheral zone. It contains a single layer of odontoblasts, which are tall columnar cells responsible for dentine formation. Each odontoblast has a cytoplasmic extension called the odontoblastic process, which extends into the dentinal tubules. Its function is secretion of dentine matrix, that is also called as predentine, and sensory signaling. Second layer is cell-free zone, that is also called as zone of Weil. It is located within the odontoblastic layer. It contains few cells but rich in capillaries and nerve fibers. Its function is to act as a passage for blood vessels and nerve fibers to reach deeper pulp regions. Third layer is cell-rich zone that contains fibroblasts. It is undifferentiated mesenchymal cells and immune cells. Its function includes fibroblasts produce collagen and extracellular matrix. Second, undifferentiated mesenchymal cells here serve as the progenitor cells for odontoblasts or other pulp cells in case of injury. Third, it also provides structural support and regenerative potential. Fourth layer is pulp core, that is also called as central pulp. It is composed of loose connective tissue with a rich network of blood vessels, lymphatics, and nerve fibers. It contains scattered fibroblasts, macrophages, and other immune cells. Their function is to provide nutrition, sensory innervation, and immune defense. Cellular components of dental pulp include odontoblasts, fibroblasts, undifferentiated mesenchymal cells, immune cells, endothelial cells, and nerve fibers. Odontoblasts are columnar cells that are present along the pulp dentine border. They produce dentine throughout the life. Second is fibroblasts. They are most abundant cells in the pulp. They synthesize collagen fibers and ground substance of the pulp matrix. Third is undifferentiated mesenchymal cells. They act as a stem cell that can differentiate into odontoblasts, fibroblasts, or other cells in response to injury. Fourth is immune cells. They include macrophages, dendritic cells, T and B lymphocytes. They protect the pulp from pathogens. Fifth is endothelial cells that line the pulp blood vessels and capillaries. Sixth is nerve fiber that include afferent fibers that are mostly A delta and C fibers that convey pain and temperature sensation. Second is extracellular matrix. It is composed of collagen fibers, mostly type 1 and 3, proteoglycans, and glycose monoglycan. They provide structural support and facilitate cell signaling and repair. Vascular supply of dental pulp. Dental pulp is highly vascularized, mainly by arterioles entering through the apical foramen. There are venules and capillaries from a dense network supporting nutrition, repair, and immune defense. Lymphatic here assist in waste removal and immune surveillance. Nerve supply. Pulp nerves are derived from trigeminal nerves, that is inferior alveolar nerve and superior alveolar nerve. Sense fibers detect pain through nociceptors. They detect temperature changes and mechanical stimuli. Some fibers also play a role in controlling pulp blood flow. Histological features in different age groups. First is young teeth. In them, pulp has highly cellularities. It has abundant undifferentiated cells and wide pulp chamber. In aged teeth, pulp shows reduced cellularity, increased fibrous tissue, decreased vascularity, and often calcification are there. Third is secondary dentine formation that lead to gradual reduction of pulp chamber size with age. Functions of dental pulp. First is dentinogenesis, as odontoplasts form primary, secondary, and tertiary dentine. Second function is nutrition, as blood vessels supply nutrients and oxygen to dentine and surrounding tissue. Third function is sensory function, as nerve fiber detect pain, temperature, and mechanical stimuli. Fourth function is defense and repair, as fibroblasts, immune cells, and undifferentiated cells respond to injury and infections. Fifth function is regeneration, as stem cell-like cells help in reparative dentine formation. Conclusion of this lecture video. Dental pulp is a vital specialized connective tissue that is essential for tooth vitality, dentine formation, and sensory perception. Its histological organization, from odontoplasts at the periphery to rich vascularized and innervated central pulp, ensure proper nutrition, defense, and reparative capacity. Understanding pulp histology is fundamental for endodontic treatment, pulp therapy, and regenerative dentistry. And this was all about histology or dental pulp. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.